Okay, welcome everyone. So thank you for joining us today to our 13th virtual seminar on applied economics and policy analysis in Central Asia. I'm your moderator, Bahram Kasimov, based at Westminster International University in Tashkent. Today we were very privileged to have two speakers. One is from Vanderbilt, Professor Katheryn Anderson. Professor Katheryn Anderson, she's a Director of the Graduate Program in Economic Development at Vanderbilt University. She's a labor economist, and she's been working on economic transition of households in Central Asia for quite a while, since early 1990s. She's also a frequent visitor to our region. She advised many our students who are emerging young scholars, including myself. So we're very privileged, and I would like to thank Kathy for her time to join us today. She will today discuss her very timely research topic on gender earnings inequality and wage policy, evidence from teachers, healthcare, and social workers in Kyrgyzstan. After her presentation, we have Rauf Salahajayev, who will discuss and provide his comments on the topic. Rauf is one of our rising, promising young economists in the country. He's a senior lecturer in the economics department, also senior research fellow at the Center for Policy Research and Outreach at Westminster International University in Tashkent. So thank you, Rauf. And I would like to remind our viewers, if you have questions during the presentation, please use the Q&A or chat function, and I will read those to you. Otherwise, we'll leave the questions to the end. Without further ado, Kathy, the floor is yours. Thanks.
Okay, thank you, Bach. It's a pleasure to be here. I've known Bach for a very long time. He was one of my students, as he mentioned, when he was at Vanderbilt as a master's student, and been very proud to watch his progress through this challenging economics profession. So it's very early here. It's 6:30 in the morning, and I'm not a morning person, but I've been up since about 4:30, so I think I've had my coffee and I'm ready to go. So I'm going to tell you a little bit about some work that I've been doing with Damir Aliyev, who is he is Kyrgyz, but he's living in Germany now, and he works for the International Security and Development Center in Berlin. I've been working with Damir for a long time, and we were interested in gender issues, gender inequality, also ethnic inequality, but became interested in this issue of wage setting policies, not just in Kyrgyzstan, but in other countries. So I'm going to this paper is actually completed, but we're working on some extensions now. So I'll just tell you what we have to date, and look forward to Ralph's comments and your comments. So the paper that I'm going to talk about today is actually published in Comparative Economic Studies last December, and this gives you the link to the online version of the paper. So for a little background, in December 2010, there was a strike by teachers in Osh and Jalalabad Oblast, and they were demanding higher salaries, better working conditions, and a big one was compensation for rising utility prices. Now you've got to remember that this was right after the revolution, which started in the spring of 2010. So the economy was trying to get back on track, but teachers were really feeling underappreciated at this point in time, and particularly in the more rural regions. And so they went on strike. In 2010, teachers in Kyrgyzstan were among the lowest paid public employees. Even though they're very highly educated, they were paid very low wages. Now this strike by teachers was happening not just in Kyrgyzstan, but in many places throughout the world. In 2010 and later, we had 3 big strikes in the United States. There were strikes in Scotland, Tunisia, Algeria, Argentina, Uruguay, Mexico, Brazil, and Venezuela. And these strikes were pretty much for the same reason, better salaries, better working conditions. The strike in Kyrgyzstan led to several positive results for teachers and other workers. So we're going to lump teachers together with healthcare and social workers because they were all in this same set of underpaid workers, and they all received the same kind of salary adjustment. In 2011, they received a new salary for the fall semester, which was basically a large adjustment in their base salary. And there was an increase in the salary for rural workers that was higher than for the urban workers because the problem was really chronic in rural areas. They're having difficulty getting enough teachers, particularly qualified teachers in these areas because of low compensation. They also had a policy to increase the salary in the high mountain areas more than in other areas. And we'll see whether that actually happened. In 2012, the salary was adjusted downwards. The reason was that the government cited a budget problem. They couldn't afford to continue to pay this high level of salary. But again, this led to more protests, and in 2015, and then also more recently in 2019, salaries were adjusted upwards. There's a large literature on gender wage gaps, particularly in higher income countries, and these papers and books highlight the importance of education, health, market experience on the gender wage gap. But in almost all these cases, discrimination plays a big part. Women's jobs seem to be undervalued. For Central Asia, there's a smaller literature on the gender wage gap, and we found 10 papers. There may be more since I last checked the literature. The gender wage gap fell from during the early independence period, 1993 to 1997, fell from about 40% to 15% in Kyrgyzstan. It changed little. The gender wage gap was about 20% in Kazakhstan in 1996, and it changed very little between 1996 and 2009. And the gender gap fell from 2003 to 2009 from 25 to 18% in Tajikistan. We don't have comparable numbers for Uzbekistan, mostly because of a date issue. So these numbers were all calculated based primarily on World Bank Living Standard Measurement Surveys, which is why we have the different dates over which these gaps are measured. When you try to decompose the gender gap into parts that are due to things like education, you find that most of the change over this period could not be explained by observable characteristics, which suggested that there was pervasive market discrimination. One interesting thing was in some work that I did with the Damir is that risk-taking was important. Women were less likely to take the risky jobs, but even if they did, they were paid less for taking risks than men were. So in the literature on gender gaps, there's also a policy literature. Some early work I did with Richard Pomfret showed that when markets open to trade, that the gap falls, and this was in Kyrgyzstan. A descriptive piece by Kardarishvili found extensive occupational and industrial segregation, and these barriers were probably due to discrimination, gender discrimination. Blau and Kahn reviewed the literature, and this is really a literature for the United States in 2003, and found discrimination could explain quite a lot of the gender gap in the United States, and suggested that in some cases wage setting policies may be needed to redress gender inequality in pay. And locally, Nurbek Jenish in 2015 looked at the first two waves of the Life in Kyrgyzstan survey and found that the effect of the 2010 wage policy that we're looking at here had an effect on hours of work. It reduced the labor shortage of teachers by 14.5%, and the labor shortage of healthcare workers by 11.4%. So these are all hours of work effects, so that hours of work increased when they implemented this first phase of the wage policy. So what is this wage policy? In December 2010, the average monthly salary for teachers was between 860 and 1,150 soms, or about $30 to $40 a month, and was as low as 575 soms in some communities. In the fall of 2011, the salary for teachers, healthcare, and social workers was adjusted upwards. There was a 10% bonus for workers with 5 years of experience, 20 years for 10 years of experience, and 30% bonus for 15 years or more. There was also a fixed payment if the teacher had a PhD in some field or a candidate's degree. There was also effect on hours of work. The minimum hours of work was lowered to 6 per week. Now this may seem trivial, but that would allow, let's say, a young mother to go and teach a little bit every week, and in rural areas that could be really helpful. And finally, when you look at the aggregate impact, the increase in spending on these workers increased the amount spent on education as a percent of GDP from 6 to 7.1%, which is a fairly large increase in overall spending. So to analyze the effect of these policy, we look at two sources of information. The first is the Kyrgyzstan labor force survey data, government data from 2009 to 2016. We're collecting more recent data. And second, the Life in Kyrgyzstan panel data, which started in 2010. And we have public data through 2016. There's a more recent wave, but it's not currently available. For the labor force survey, these data were collected annually and by quarter. So we're looking at the quarterly data for descriptive purposes. And what I'm going to show you will be some graphs for wage workers who have positive monthly salaries. So we're eliminating people who have jobs but don't get paid anything. So the age range is mostly the young 20s to their 60 for men and women. And you can see when I show you the graph that the wages of women relative to men in every year are low. In 2010, the wages of women were 70% of the wages of men, and by 2016, that had increased to 77%. These are the annual averages. So the largest relative wage changes were among those affected by the policy: teachers, healthcare, and social workers. So this graph is going to show you the average monthly wages by quarter for all workers and for males and females. And you can see this starts with the first quarter of 2009 through the fourth quarter of 2016. So you can see that for men and women as well as total, that there was a jump up in the third quarter of 2011, which is when the policy went into effect. Because there was a revolution in the first and second quarter. So part of this jump would have been due to getting over that, but the size of the jump is not just attributed to the end of the revolution. It is definitely due to the wage policy. And you can see that for women, the blue line, the jump was much larger than for men. And this graph shows you the affected sector: teachers, healthcare, and social workers. And again, you can see that there was a huge jump in the third quarter of 2011, which is consistent with the policy effects. And then following that, there's not a lot of change. Now for the Life in Kyrgyzstan data, these are annual data. A couple of waves were collected in October, and a couple of waves were actually collected in the winter, so we do adjust for that. We look at, this is the data we're using for our multivariate models, so we have a more focused sample than what we use for the labor force surveys. But here we're looking only at persons who report positive earnings. They're not self-employed. They're not employed in agriculture or mining, and we drop them because they're really not competitive with teachers, social workers, and healthcare workers. They also all completed secondary education, and they're aged 23 to 65. So you can see we actually have pretty much of a balance between men and women reporting positive earnings. Now this table is some descriptive statistics for the pooled data from 2010 through 2016, and we're looking at the monthly earnings, and then we calculate the female to male ratio in percentage terms. And you can see that in terms of monthly earnings, women were earning over the whole period 76% of what men were earning. On an hourly basis, women were earning more, 84%. And for hours of week, women were working about 90% of what men were working. And for our sample, we have almost 40% of the women's sample would be in this sector, and about 13% of the men are in this sector. So this is a female-dominated sector. For teachers, healthcare, and social workers only, in comparison to other jobs, you can see that this sector is paid less, at least on a monthly basis. And this is largely due to differences in hours of work. So the monthly wage, the nominal monthly wage for workers in this sector was about 88% of the nominal monthly wage for other workers. The hourly wage for the, and again, this is the whole period before and after the policy, the hourly wage was actually higher for workers in this sector, but hours of work was lower. This graphs these trends over time with the 5 waves of the LIK. You can see that the red represents teachers, healthcare workers, and social workers. The blue line represents other workers, and the black is all of them. And you can see that there is a jump up for all workers in 2011, but that the jump up for the workers who are teachers, healthcare, and social workers is much larger in 2011 than for other workers. Then the wage gap between the two sectors didn't change very much until like 2013. It started to widen again, and then remained at that level through 2016. This looks at the gender gap, the gender differences, the ratio of the wages. These are monthly wages, nominal, of women to men in percentage terms. And it looks at, again, the red is teachers, healthcare, and social workers, and the blue is other workers. And you can see that in 2010, the teachers, healthcare, and social workers, the wage gap was much larger, around 68%, than for other workers, which is around 77%. But by 2011, the affected workers were making more. Women were making a lot more relative to men than in the other sector. And that gender gap continued to shrink for teachers, healthcare workers, and social workers over the entire period. And you notice very little change in the wage gap in the other sector. So for our model, our outcomes are monthly wages and hours of work. The policy variable we look at is if the individual is in the affected sector, teacher, healthcare, or social worker, and the year is after 2010. We also look at rural interactions with this policy variable because the policy was supposed to increase the wages of rural workers more than urban workers. And we look at year interactions because there were policy adjustments over time, which I explained earlier. We included some interactions with elevation. So we defined elevated communities as those with an elevation higher than the median and looked at some interactions with the elevation. So what we're going to focus on mostly is the direct effects of the policy plus these interactions with the rural and year variables. We control for other things such as experience, education, ethnicity, region, and the season of the interview, whether they were interviewed in the fall, like the harvest season, or whether they were interviewed post-harvest. The model is for the wage model, it's a standard earnings function with the log of monthly wages as the dependent variable. We use random and fixed effects. We have fixed effects for year and the job. And we look at policy interactions with these variables. We control for elevation, but none of the interactions there was significant. So we always find that high elevation jobs pay less than lower elevation jobs, but we don't find that the policy had any impact on the relative pay of elevation and high elevation jobs. So this just gives you an equation which shows you the model that we're using. This is the direct policy effect. This is the direct effect of rural residents. These are the direct effects of each year. This is to see whether the rural areas are paid more than urban areas. This is to see whether, after the policy. This is to see whether after the policy there are differences by year. And then finally, we're seeing whether there's a difference by year, rural, and being in the policy group. And then finally, these are the control variables. And what we do from this model is calculate predicted wages if the worker is urban or rural, in the education, health, or social services sector, or other jobs, and by year. So I'm not going to show you a bunch of regressions or tables with a bunch of numbers in it. So I'll just summarize graphically the major things that we find. I'm also not going to report the hours of work results here. The hours of work effects are really small. So the policy's effect was primarily on hourly wages. But this is the monthly wage, our predicted wages in SOMS. And this is a graph for the rural communities. On the left, we look at women, and on the right, we look at men. We have two sets of bars. The left set would be the affected workers. These would be teachers, healthcare, and social workers. And the right set would be the other workers. And each bar gives you a different year. So we'll start with 2010 with light blue and end up with 2016 with the dark blue. So first, we want to compare the teachers, healthcare workers, and social workers who are women to other workers. And you can see that in the first year, 2010, these are our predictions from our model. Other workers are making significantly more than workers in the policy jobs. So there's a gap in favor of other workers for women in rural areas. Then after the policy goes into effect in 2011, you see a huge change. Now, teachers, healthcare, and social workers, women are predicted to earn more, over 6,000 SOMS, relative to women, rural women in other jobs. And then there's a growth over time, as you would expect, because these are nominal wages. And then following 2015, another bump up. And you can see, okay, there's also growth here in other jobs and a bump up in 2016. And by 2016, there's very little difference in the wages of women in rural areas in these two jobs. We see a similar but a little more volatile pattern for men. Again, in rural areas, men in other jobs were making significantly more than men in the affected jobs. There was a big jump up in 2011 so that they're close to parity. 2012, again, they're close to parity. 2013, the men teachers and healthcare workers dropped a little bit relative to other men, but by 2016, they're close to parity. So what do the rural figures say? For women in rural areas, teachers, healthcare, and social workers earn less than other workers before the policy. And after the policy is in effect, teachers, healthcare, and social workers earn more than other workers. And by 2016, the wages of workers in these two sectors are similar. And for rural men, a similar pattern, teachers, healthcare, and social workers earn less than other workers in 2010, earn more from 2011 to 2012, and by 2016, the wages are similar. This gives the same kind of predicted analysis in bar charts for urban workers. You see a similar pattern. For women, teachers, healthcare workers, social workers earning less in 2010 than other workers, but earning a little bit more in 2011, very close to parity, actually in every single year after the policy goes into effect. And we also see that same kind of pattern for men, although there's not much difference for men in the initial period. So most of the impact was taking place with women. So what do the urban figures say? For women in urban areas, the same pattern as with rural women. For men, the wages of workers in these two sectors are very similar in all years. So the policy had the largest positive effect on wages of women, especially in rural areas, which, you know, the policy was designed to have its biggest impact in rural areas. And as a result, there was an improvement in the gender gap overall in both urban and rural areas. And we can see this gender gap impact a little bit clearer in this figure. So this is showing in percentage terms the nominal wages of women relative to men in rural areas, which is this blue, and urban areas, which is red. The solid line would be teachers, healthcare workers, and social workers. The dotted line would be other workers. So you can see that the gender gap was smaller in the first year if you were a teacher or healthcare social worker, smaller than in other jobs. But the gender gap really shrank enormously. So it was over 90% on relative wages in 2011 in the teaching healthcare sector. And it was much lower than that, only around 70% in other jobs. I mean, in the urban area. Let's see. Yeah. So, and this was quite a bit different when you were in the other kinds of jobs. These dotted lines represent the other jobs. You see a similar effect in the urban areas, the red. And what's interesting is that by the end of the period, you can see that in all sectors, the gender gap is approaching a similar number. So over time, the gender gap has really shrunk overall, and it's sort of approaching around 85%, which, you know, in comparison to like the United States, that's really quite good in terms of salaries of women relative to men. So I'll conclude. The policy met many of its goals and suggests that this wage setting tool is a powerful way that you can redress the wage gaps. So wages for teachers, healthcare, and social workers increased relative to wages received by workers in other jobs. Rural areas experienced larger increases in wages than urban areas, and the gender gap in wages narrowed for teachers, healthcare workers, and social workers after 2010. And as a result, because this particular occupation category is so important for women, the gender gap overall in wages across all jobs narrowed after 2010 and is approaching over 80%, which is really good level in comparison to even high-income countries. So the wage setting policies can, in some cases, be effective in reducing overall gender gaps in wages. Thank you very much.
Cassie, thank you very much for a very interesting presentation. Now I will give the virtual floor to Rauf. Rauf? Over to you.
Thank you very much, Katheryn, for presentation. It was very good. I have my own question, which is kind of related to this issue. We're doing research right now, which is touches the issue of globalization and gender inequality among companies in Uzbekistan. And we're using the World Bank Enterprise Survey. And what we found is the firms which export more relative to non-exporting firms have higher levels of gender inequality in terms of pay gap. When we tried to look into this matter more deeper, we found out that, for example, in East Asia, the impact is reversed. When firms export more, the gender pay among men and women decreases. But when you compare to evidence from South Africa to some Middle East and North African countries, exporting firms are associated with the higher levels of gender inequality. Could you, for example, touch those issues as well, or give your expert opinion? Because I would say this is also relevant in the context of your overall gender pay research.
So let me you found that for export firms in Uzbekistan, the gender gap was larger in the export firms than in other firms?
Yes, the relative regression analysis shows that yes, if firms start to export, the gender gap, pay gap rises relative to firms which do not have, for example, exports in their sales.
Yeah, that's unusual, because usually when there's a lot of international competition, that force would push the gender gap in the opposite direction. But I think a lot of it has to do with sorting into jobs. Like what are these jobs? Are these high-tech jobs? Are these lower-tech jobs? Are these jobs that are the export jobs requiring more labor, manual labor? Or do they require education? So you find that in jobs that depend on more service, and a lot of sector jobs, export sector jobs can be service oriented, that the gender gap would shrink. But if they're not service oriented, if they're more manufacturing based, which is more of a male dominated occupation, then the gender gap could rise. So I would need to know more about what the composition of the jobs was. There was a study by the World Bank also looking at enterprise data for Kyrgyzstan, and I believe that they were finding that the service sector was really important for women, as they were getting more employment, better wages as the jobs became more service oriented. That's changing now, probably, but I don't know Uzbekistan as well. So, what were you finding in terms of the composition of these jobs?
One of potential explanations was that in Middle East countries, North African, Central Asian countries, there is an education gap. And parents invest more in education of boys. So whenever companies hire people and get access to export, the female workers which are hired they're mostly hired to a lower, I would say, paid jobs, or to the jobs which have, for example, higher labor intensity, lower productivity, and therefore they're paid less relative to men. Do you think this could be, for example, one of the explanations?
Exactly. I think that, again, it depends on what is being exported, what's in the export sector, and what is the human capital or versus labor composition of those jobs. So we know in Kyrgyzstan, for example, women really are more educated than men on average. They're more likely to have college education. They may sort into a low-paid sector like the teaching profession, something like that, service-oriented. But if you are exporting jobs that need a high level of education, mostly from their workers, then that would be good for women in terms of their pay. But if the jobs that are export jobs are of a different kind, where the human capital is not that important, again, maybe more heavy manufacturing or agriculture, which would be the case in some of the African countries you're talking about, then that could be bad for women because you're increasing demand for low-paid jobs. And then if you look at the aggregate gender gap, then you can see it worsen as workers are sorting more into the low-paid sector. So, every country is different. It depends on, how important exports are to your market and exactly what you're exporting relative to what you're importing and what you're producing for your own market.
Yes, thank you.
That's an interesting result. I'd like to see what you're doing.
Yes, we will send you the results because we introduced a wide range of controls and stuff, and the result is very interesting to see further.
Yeah, for sure. Sometimes you also may get a different picture when you look at what firms report than if you look at what workers report.
Yes.
I know that in Uzbekistan, until recently, you didn't have, oh, hi, there's your son.
Oh, that's my nephew, niece.
Your nephew? I've got my cat wandering around back here. Hi. So, what workers may report from their families could be a little bit different than what you see being reported by firms. What do workers actually receive? Sometimes it used to be a problem in Central Asia with wage arrears. So you might have firms reporting that they're paying certain wages, but when you look at what households actually receive, it's quite a bit different. So I know that Uzbekistan is now getting some good household level data. And it would be really interesting if you can, within the household level data, do a comparison. See if you can say, these are the export jobs and these are not. These are the domestic jobs. And what's the difference? Because sometimes you can see better what the workers are like who are actually sorting into these kind of jobs if you can go to the household level.
Yes, thank you.
Okay, I would just like to remind our viewers, so you feel free to send your questions. So in the meantime, Kathy, so are the results driven by teachers or healthcare workers? I wasn't sure about the composition of the sample. Was it mostly teachers or equally divided between social workers, healthcare? And then how much did this cost to the government as a percentage of, let's say, GDP? And would you say this is a successful policy? And there's a question: can you recommend this policy to other countries, such as in Europe, to close the wage gap, gender wage gap?
Yeah, the cost was quite high. So in 2010, the government was spending the expenditures on education were about 6% of GDP, which if you compare that to even high income countries, that's pretty high. And there have been some studies as to why it's that high. So there are some issues with expensive procurement, inefficiencies within school organization, that the World Bank has done a really good study of expenditure review of why the cost of education is so high. The cost of healthcare also high, and it's, again, it has to do with issues not related to what they're paying their workers. So when the policy went into effect the following year, we were told that the expenditures on education went up to 7% of GDP. So that was a huge jump. Now I'm not talking, you add on top of that the expenditures on healthcare. The social service sector, that's small because the payments people receive in social service is really, really trivial. And so that's a small sector. So the healthcare and the teachers, they're large sectors and they're pretty comparable in size. Social workers, small. But that jump really put strain on the national budget, which is why they made a big deal about that first year the policy went into effect. They're causing this salaries to go up. That's a good thing. But in the following year, they said, well, we can't afford it anymore. So then they made some downward adjustments or didn't continue to raise nominal wages. You can see that from the graphs that they kind of flattened out. But then I guess there was a lot of political backlash over that. So then they increased it again. I don't have the latest numbers on the share of GDP going to education, but the sector, this has been recommended by the World Bank, the sector really needs an overhaul, particularly on procurement and some other administrative inefficiencies. Teachers are underpaid relative to high income and middle income countries. They're highly trained workers and they're paid relatively low. So was the policy successful? We think the policy was successful, and that when you're dealing with government workers, which is a wage setting occupation, then the only kind of policy you can implement is wage setting. So just adjust the government formula. The formula that's used is very similar to what's used in, let's say, the United States, at least for teachers. It's based on seniority and education. So you get a college degree, you get more. The longer you're there, the more you get. Whether or not you're good at your job, you're just going to get more. So as far as we could tell, that particular structure didn't really change very much, but they were now rewarding people for staying in the profession longer. So you want experienced teachers, good ones, to actually want to stay in teaching. And another issue which we found from talking to some officials in Kyrgyzstan is that there are subsidies to students to go to pedagogical universities to train to become teachers. So they low cost education, close to free. But very few of them become teachers. So you're providing free education to train teachers, but then you don't make them become teachers. They can make more money in working for a cafe or migrating, or they used to be able to migrate. So that's another example of sort of an inefficiency in the way you're trying to create this sector. You're putting a lot of money into training, but you're not getting the trained labor to come back into the sector. So that should be redressed. So there are a lot of things like that which have been suggested. Performance pay has been shown to be quite effective in some situations. There have been experiments in lower income countries than Kyrgyzstan where performance pay has been shown to work, but then in other cases it has been shown not to work. So again, it depends on your institutions and the way the reward system is set up. Can this be a useful model? It could be for countries that are similar. So Kazakhstan adopted the same kind of policy, and I understand that Uzbekistan has also recently adjusted the salaries for workers in the same sector. And it would be great to be able to see with, again, household data primarily, also maybe the enterprise data, we could see that if the enterprise data includes government, see whether these same kind of things happened. So that's another thing we'd like to do if we have access to information, just to see whether this can work in other situations. But again, these countries are all similar. Could I say work in South Africa? It's a different institutional environment,
Right.
so not sure.
Another related question is, have you looked into, since there was a big jump in wages, especially in rural areas for teachers, were these linked to student learning outcomes for those years? Did students benefit in schools because of better paid teachers? Have you looked into that?
Yeah, we tried to look at that to the limited extent possible that we had with the LIK data. We don't have test score data in this survey. And since this is household surveys, it's going to take some time actually to see whether the teaching practices change. With the limited information we had from the LIK, we couldn't see much change over this period. The latest PISA test scores were for 2009. So I think that if Kyrgyzstan is going to participate in the next PISA, we could see whether the policy had an impact, because that would cover the post-policy period. So that's sort of anybody out there looking for some research to do. If that data are available, then that would be a really good way to go. Or to get a hold of the test score data from Kyrgyzstan. Again, there are going to be lags, but you would be able to see, students that entered in the testing cohort before and after, if there's any difference. But we don't have access to that information yet. That's really the bottom line. Are you just paying teachers to do the same old thing and getting the same bad outcomes? Or are they actually changing the way they do things? So that's a good research issue.
Right. Another thing is, in 2016, you also see widening gender gap. So, and I'm not sure what the situation now in 2020, but why do you think after it converged, it's diverging again? Is it because of the, you alluded in the literature review, pervasive market discrimination or risk-taking? Why do you think it's going back to old practices?
Well, it's never going back to the same level. So it converges, and it looks like, and you could argue in an equilibrium framework that what happened initially in one sector is now spilling over to other sectors. So now other sectors maybe are becoming more competitive, because women are less likely to leave this affected sector, and so the other sectors also have to raise wages, and so there could be some equilibrium adjustment that could cause all sectors to converge to a similar level. But the trend is up. So the gender gap shrank, and the periods in which the gender gap shrinks the most are those really in which there is a policy change. So I think that there's just some adjustment over time. We can't account for everything that was happening in the markets at that point in time.
Okay, so there are some other questions from the audience. Let me read. So, what about, so women in urban areas versus rural, which jobs bring more return to women?
Women are doing really well in jobs that require education, like technical kind of jobs. So highly educated women going into business, consulting, high-skilled jobs like that are outside of teaching, they do really well. The agriculture sector, there's almost no gender inequality. The wages are almost exactly the same, but I wouldn't say that that's a sector that most women at Westminster really want to target unless they're in management. But I think that in this region, women are still clustering into service sector jobs, and the higher tech service sector jobs, they're doing quite well.
Mm-hmm. Okay. Another question is, have you also looked into the wage gap of teachers or healthcare workers between public and private sector? If there were any differences, were the policies applied in both sectors?
Yeah. The policies apply only to the public sector, and for the sample that we're using, the private school sector is really, really small. We have very few, just a handful of teachers who are teaching in private schools. So we weren't able to see anything by looking at that difference. That's a very good question as to whether the private sector is paying more. We think that in some cases, particularly those private schools that are associated with another country, like Turkish schools, that they pedagogically, they're quite good on average, and they pay well. There's also some evidence that some of the religious schools, which would be private, are not well paid or as pedagogically good as, let's say, Turkish schools are. But with our data set, we can't make those fine distinctions. That what I've learned about that is from reading reports, primarily from the World Bank.
Mm-hmm. Okay. And there's another question, I'll just read it. Since women's labor is more complex than males, they have less non-leisure time at the household, so their experience is affected. What kind of instrumental variables you have used to avoid endogeneity? Some policies adhere to the male earnings based on experience. But I don't think you use instrumental variables. Perhaps you can speak about it.
No, we're using, these are panel data models. So with the panel data models, a lot of what you're assuming is that what drives people to select one job versus another is captured in the error term, and that the error term is constant over time. So this can be a big assumption in some cases. There's a lot of research on this, these older selection bias models. You're not seeing a lot of people adjusting for selection bias the way they used to in the 1980s and 1990s, because these selection bias models are very sensitive to the form of the distribution you impose on residuals. So most of the work now, and you can, this is a semantics. We can call these conditional wage functions. What is the conditioning factor? The conditioning is that they've already made the choices to be in these sectors. So what we're abstracting from is that initial choice. Now, a question is whether that initial choice really changed very much over the period in which we study. And when you look at the data on occupational selection, it doesn't look like it changed very much at all. So this is also from other people who've looked at the same issue. It doesn't look like the policy really changed the choice of what sector to go into, but it might have changed the intensity with which you worked in that sector. Do you work full-time? Do you work 2 or 3 jobs in that sector? So one benefit of this kind of policy that pays more is that women would not feel like they had to work at 2 schools at the same time. They only may need to work at 1 school, which means they would do a better job at that 1 school and also have more time to take care of their families. The questions for women are very complicated and difficult. Women in Kyrgyzstan, and not just Kyrgyzstan, have a primary responsibility for taking care of the home and the family. And so we essentially have professional life or working life, and we have housework requirements and childcare requirements. And in Kyrgyzstan, you used to have daycare centers and firms, and that helped women with this problem. There's almost none of that anymore. I would assume the same is true in Uzbekistan. So the burden again falls on women. How do you do that? You either don't work, and there is some evidence that the labor force participation of women has declined over time relative to men, and part of it is because you just don't have any alternatives. How are you going to take care of your kids, of your children, take care of the elderly in your household if you don't have any social support? So, yeah, another thing with this, you know, I said that the social services sector is small, but it's also quite important in some cases by being able to provide families that are on the margin with a little bit of extra support. And that's probably something from a policy perspective that needs to be reevaluated. And that's true in my country as well. You know, putting too much emphasis on some areas and not on others, and making sure that women have adequate income and take good care of their kids and their families has so many important long-run social benefits to everybody. That should be at the top of the policy list, in my opinion.
One last question before we go. So there is a discussion about, so this paper was done mostly based on quantitative evidence. Mm-hmm. What questions do you think would lend to a qualitative design by direct experience, explore meaning and potential action addressing wage disparity in Central Asia?
Well, let's say you wanted to focus on this sector, because this is a really important sector for women. A third of women's jobs are in this sector. So I could see the role, some very important work, qualitative work, interviewing women about what they need, salary adequacy. What do they do with their extra income? How do they, you raise some interesting questions. How do they balance their time between work and family? If they're a teacher or a nurse or a doctor or a social worker, what do they do with their children when they're working? How do they manage their time? I think these are really, really important questions, and you can't answer these questions with quantitative data. That the quantitative data will just give you sort of a broad picture, but by talking to people, you can often find out how they really deal with family, how they really deal with community, and how they really deal in their job. Are these incentives good enough for them to actually want to invest in making a change in the way they do their job? You raise that question about what is the outcome of this? Are students better? Is this enough of incentive to make teachers better, to make doctors better, so that we all benefit? And looking at a PISA test is one way to do it, but that's just a small picture of what's going on. Because as we're finding out in this pandemic, when kids can no longer be in school, and parents have to bear the burden not only of educating their children, but taking care of them and working, and all of this from the home. How are they doing this? How are they doing this? And what are the constraints that they face that are so important? These are really, really important questions. And qualitative, interview-based research is central to trying to understand how people live and to help us, you know, address the right questions as policymakers. I don't think that we should just make a policy based on just looking at numbers like we've generated today. I mean, you all have raised really important questions. You need to talk to people about what they do if they have more money and what are the constraints they face in their lives. You need to talk to people.
Okay, with that, questions, lots of questions for our audience, food for thought to think about, to perhaps some people will take inspiration to go after these questions in a systematic, deep, qualitative or quantitative way. So thank you, Professor Anderson. Thank you, Raul, for today's discussion. Thank you to our viewers. Please join us next time. It's our last session of the summer virtual seminars. And I would like to thank our organizers from IAMO and IFPRI for helping us to organize these online webinars for you. With that, Kathy, Raul, stay safe. To our viewers, stay safe and healthy. Bye-bye.
Stay healthy. Bye.
Thank you.